and yes off. Greetings, everyone, again. Welcome to the Share Network Community Partner Meetings. My name is Renee Kroplewski. I am the Administrative Director here at the Share Network, and it is my pleasure to be with all of you on this beautiful September Monday, first Monday that we're all together in September. And I'm very thankful that you are part of this network and that you've come to join us. The purpose of having these meetings is truly being able to stay connected, hear about all these different programs going, program updates, and sharing resources throughout the aging community. It's important to keep this network going, to be able to serve as many people as we can. So we're very grateful that you're all part of this and that you all join us as much as you do. And for just for agenda's sake, we have two great presentations today. Not one, but two great presentations. We're going to be hearing from University of Chicago, Suzanne Lino, Project Manager of Community Benefit within the Urban Health Initiative, as well as Sherry Thomas, the Manager of Community Engagement, and Maria Ruiz Torres, the Community Engagement Coordinator from Access Community Health Network. So we've got two big resource presentations here for you today. And then afterwards, we'll open it up from each presentations just for some Q&A, just to make sure, we can get you everything you need for after these presentations. And then we'll also open up for any program updates, wanting to make sure that you have a chance to share about events that you know of that are coming up, anything that we can share with this network and keep everybody on top of all of the good things happening out there. If you can introduce yourself, we wouldn't mind if you introduce yourself into in the chat. Just let us know, where you're coming from. If you'd like to share your contact information, that is wonderful. I see a couple of examples, and we will actually get started here. Look at all of those. Thank you so much for starting out and starting some of those conversations. Before we get started with our first presentation, sometimes people have to leave ahead of time. Is there anyone that knows that they're going to have to pop off early and would like to share a resource ahead of time before they have to leave? If not, we can save it till the end. Nope. All right. Fantastic. Well, then we are going to start out again with the first person that I mentioned. I'm going to be handing this over to Suzanne Lino, from the University of Chicago's Urban Health Initiative. And I'm going to let her talk a little bit about some of the programs that she's working on right now and how she needs your help. So Suzanne, all you.
Thank you, Renee, and just wanted to thank everyone on this call for inviting me to today's meeting. So I work for UChicago Medicine with the Urban Health Initiative. We're the community health arm for the hospital. And so today I wanted to talk about a large endeavor that we're undertaking right now, which is our community health needs assessment. Many of you are probably from other hospital or healthcare organizations that may be familiar with your own CHNA, but just wanted to give an overview of how we do it, and then how you might be able to get involved with it. So I have a few slides. I'm going to try and share my slides here. Let's see, there we go. Okay, so I'm just going to, I have like 15 minutes to talk about the CHNA, so I'll spend 10 minutes just going over background for the CHNA, as well as, where we're at with the data collection portion, and then we can end with some questions and answers. But of course, feel free to just come off mute and ask me any questions if anything comes up while I'm speaking. So to give some background about community benefit, in 2010 with the Affordable Care Act, there were new requirements for all tech-exempt hospitals. And so we have been mandated to assess and respond to community health needs by conducting a community health needs assessment and develop a strategic implementation plan to address those needs. We also have to report on our progress and our performance to the IRS in an evaluation report, which looks at the previous 3 years. And all of these documents, all these requirements need to be published on our website every 3 years. And at the end of the presentation, I have a link, a web link where you can find all of our previous CHNA documents. There we go. So the goal of the CHNA is really to use a systematic and data-driven approach to determine the health status and the needs of our hospital service areas. The CHNA is used to drive and inform our community health efforts and to advance health equity. So for those of you familiar with UChicago medicine as a system, our 2 hospitals, one in Hyde Park and one in Ingalls, they have their own community health needs assessment requirements that they have to do. And so we talk about the service areas a little bit different. And in a few slides, I'll go over, what exactly encompasses our service area for the medical center. There we go. So why is the CHNA important? So like I mentioned, I work with the Urban Health Initiative. That's the department I'm in. And so a lot of our programs and our grant making goals are specifically tied around the CHNA health priorities. It allows us to really understand what the community thinks are its strengths and its challenges. And we really try to talk about the CHNA as our way to uplift community voice. It's their opportunity to tell us, how can we better serve them through our programs and our services. We come up with the solutions together through the process. Of course, it's a federal requirement for us to keep our nonprofit hospital status. And so I'm always reminded that, without our tax exemption, our operations would be very impacted. And so from a financial standpoint, it's very important. But really, the mission of the Urban Health Initiative and the mission for UChicago Medicine is really to promote health equity, and the community health needs assessment allows us to do just that. We come up with this strategic implementation plan, which is meant to improve communities' health. So I won't go over this in great detail. I can share this with Renee, and she can share it out with the group. So don't feel like you have to read everything on here. But this is just to show that the CHNA is really a process, and it's an ongoing process. So we assess our needs through primary and secondary data collection. We set the priorities with internal and external stakeholders. And then we work with subject matter experts and other internal stakeholders to really develop the strategic implementation plan. We're tracking, our progress in our programs through various ways, like our inventory, our annual community benefit report, our IRS Schedule H Form 990. We evaluate that progress through our evaluation report, which looks at the previous 3 years, and then we're constantly reporting on everything. So the CHNA, for example, is due on our website June 30th, 2025. So this is just a visual timeline of each component within the CHNA. So the CHNA is being conducted in 2024, 2025. That process itself takes 2 years. The evaluation report looks at the previous 3 years, and then the strategic implementation plan looks forward and tries to really forecast, how can we address those needs that come out of the data. So I'll talk about data collection now. Well, I guess I should pause it. Any questions related to what I just talked about? So I'll go into our CHNA data collection, which is the main reason I connected with Monica Long and Renee. And then thank you again for inviting me and talking more about how we can work together with the Share Network. So we collect our primary data in a few different ways. So we have our community resident surveys. We also conduct community resident focus groups, as well as a focus group with healthcare and social service providers. And we also work to validate all that data through key informant interviews. We also look at secondary data, like hospital utilization data. And there's a lot of secondary sources that we look to, including the American Community Survey, and Chicago Department of Public Health data. And our service area for the University of Chicago Medical Center really focuses on 12 zip codes within the South Side. So you'll see here, a map, the blue map of Cook County, and where our service area is on the South Side. And those 12 zip codes were identified as being of the most need around our hospital. So where we're at with data collection, today, we opened our CHNA survey on July 15th, and it will close in October. We spent a couple months really looking at our survey and trying to make it as condensed as possible. We worked with our community advisory councils, which has civic leaders across the South Side and the South suburbs to really pare down, what are the essential questions that we want to ask the community. And so you'll see here we have 2024-25 sample size targets in yellow. And those are based off of, the population estimates for our service areas. So as of Thursday, UCMC, that's University of Chicago Medical Center, we have 191 surveys. So we're about 30% complete with our goal, which, we hope we're a little bit further along, but that's why we're, making a big effort to go around to community meetings. We have tables at events, and, that's a big reason why I'm here today is really to, ask all of you if you could promote the CHNA survey with your networks. We have had a lot of success with going to community events. So if any of your organizations have any events, any meetings in September and October, please let me know, and I'd be happy to attend. We know that what works is being in front of community members and talking to them one-on-one about the importance of the CHNA. We also know that another effective tactic is a direct ask from someone So a lot of times, if you have family members or your networks in the South Side, doing that direct ask, like, hey, can you fill out this survey? That tends to go a long way. Of course, those of you that have newsletters or email blasts, we have some sample promotional language here, and we have the image on the right, just as like an example of how we put it out in social media. So the survey link is there. Like I mentioned, there's a survey link for residents that live on the South Side, and then there's another survey link for residents that live in the South suburbs. I don't remember if this these community partners are focused more in a certain area, but I'm also happy to share the Ingalls survey with you all later. We also have a lot of printed materials. So we have a postcard that's 4.5 by 5.5 inches, very short. We give those out at community events. and flyers in English and Spanish. I should mention the survey is available in English and Spanish, and the QR code that you see there leads to a landing page where you can select, English or Spanish. So that is basically it. If for those that have any questions, or if anyone is wanting any materials for the CHA, my email is up there. And then there's a link to our community benefit webpage, which has all of our previous materials for the community health needs assessments. We also have in 2018, 2019 CHA period, we had we created community profiles of all of the zip codes. So if any of you are interested in that data, that's a good resource as well. So I'll pause there to see if there's any questions or any comments from anyone.
Looks like you already have someone asking for a copy of the flyer to take to presentations for tomorrow. And we'd love to we at the Share Network would love to take, you had that yellow, the nice image a couple slides back. If you could send that our way, we'd love to get that posted up on social media for you as well. So if anyone can, take that moment, fill out that survey, go through and be able to help with those number. Data is important. It helps gets us where we're at. And, I know we all understand that very much. So, our team, especially with, being, a grant funded program, we want to make sure that we can continue those programs, and that's how we prove it. So thank you, Suzanne, so much. Again, we'll share that out. I've already put it in our Share Network newsletter. So please make sure you check that out in our newsletter. We'll be posting it on social media. I'll also share Suzanne's PowerPoint and make sure this gets in all of your hands as well. But thank you for bringing this to our attention and for sharing this. We do appreciate it big time.
Yeah, thank you, everyone. And like Renee said, I'll make sure to get all the materials to her, including some easily shareable ways, because we know it's always difficult to get the word out if it's not easy. So we try to work hard to make sure that it's easy to share. So thank you, everyone.
Yeah, absolutely. Thank you. Okay, without further ado, just to be in interest of time, as I mentioned earlier, we have another set of presenters from Access Community Health Network. Again, we have Sherry Thomas, the manager of community engagement, and Maria Ruiz Torres, community engagement coordinator. All right,
thank
Sherry.
Thank you so much, Renee.
Yeah, absolutely.
Are familiar with our team member, Regina. So we are happy and honored to be able to attend the meeting and present on behalf of Access Community Health Network. And I hope can you guys see my screen? I'm having a little trouble with my computer, but can you see my screen?
We can, yes.
Yes.
All right. So to start off, one of our objectives is to really have Access Community Health Network as a patient's medical home, where they can come and they can pretty much assess and get access to, a variety of different health services, including programs that tends to the need of their overall health and wellness. And that leads into our mission. Our overall mission is to partner with patients at all points of their care, providing them with quality health care and a patient-centered medical home that's really accessible to them right in their own communities. And that leads into more about who we are. When we say that our mission is to really be available to people right in their communities, we have 35 health centers. If you've ever driven around Chicago or some of the suburbs, you see the that square blue box. That's one is here in the corner on top, my left, your right, um, uh, hand side of the deck. And that's one of our health centers. So we have quite a few health centers. We're on the south side of Chicago, the west side of Chicago, the north side, the south suburbs, the north suburbs. So we are trying to really make an impact in communities throughout Cook County as well as DuPage County. We see about 165,000 patients per year. And we see also a lot of Medicaid patients. We have a lot of pediatric patients under the age of 18, about 56,000, and about 4,500 and counting prenatal patients that fall within our network as their primary care home. And we also serve within all of our health centers, we serve about 16 communities throughout Chicago. And some of the health disparities and needs that we provide care for, it's a range of everything from cancers to diabetes, anxiety, heart disease, hypertension, which are a lot of the main illnesses that a lot of our underserved communities are facing. And I'll say when we're out in the community and we are engaging, and we may meet a community member that says they haven't been to the doctor in like 20 years, but they have some health issues. And a lot of these health issues, for the most part, they can be addressed, if they are treated early on, right? Before they get to certain stages. But again, in a lot of our underserved communities, people are dealing with so many factors, even beyond this snapshot of health disparities. And they're just trying to make it day by day, keep a roof over their head, bills paid, just trying to, maintain their households. And so, we definitely strive to make sure we try to treat people with whatever health issue that they're having and really be able to provide them with the health care that they need. Now, and not only the health care, but also the support. And in our health centers, we do provide a variety of health services and support programs. And this is a snapshot of some of our programs. This does not list them all. It will probably be about 4 or 5 pages long. But this is just a few of our key programs and services that includes everything from family medicine, behavioral health, substance abuse, and as well as specialty care, transportation assistance, and we also have a whole team of benefit specialists that can help people navigate that whole Medicaid, Medicare landscape, which we know can be often very challenging. And again, this is just a snapshot of some of our services that does not include all of them. And again, just to reiterate, we want to definitely make sure that we are, a medical home for community members, individuals, families, everyone that needs this type of support. And with that, we definitely see everyone from newborn babies all the way up to our older adults and our seniors, which is also the focus of the shared network, our older populations, which is very important that, we take care of not only our younger individuals, but we must take care of our older populations. I'm entering that space as well myself. And, it's really important, that we are able to provide the quality and the needed health services that, our older populations of people need, including support services. When it comes to making sure, that they can get access to their medications, and not having to go to a bunch of different providers or specialists. Our leadership team, we're really working hard to be able to provide all those needed services right in one location. So you don't have to go on the bus and already come to your doctor, but also maybe go on a bus or maybe a family member or some other transportation away to get to all these other places. And so, it's very important for us if we're going to say that we're going to provide services to everyone at every age, every stage, we have to be able to provide them with the health services as well as the support service. And then just to touch on for people paying for their visit, we take all health insurance, Medicaid, Medicare, and private plans as well. And for people who are uninsured, we also have a sliding fee program based on their income that people can apply for if they don't have health insurance for whatever reason. And then this is just like a snapshot, a picture of me and a couple of team members. And it is very easy to make an appointment at Access. We have a contact center where people can call, and that number is 866-267-2353 to schedule that appointment. We also have a public-facing website at www.achn.net. And then we have this little thrifty QR code, which is now all the rage, that people can scan and also get access to scheduling an appointment. And this is a snapshot of a map of the coverage area that we cover. It's a little small, but again, we cover a very wide range of area, all the way from the south suburbs, all throughout Chicago, and then into the north suburbs, and even into DuPage County. So we have a very large footprint. And again, we just want to make sure that we're able to help people get connected to quality health care. And to sum it up, this is Regina's contact information. I did put my name and contact information in the chat. As community engagement team, we do come out and participate in various community events and fairs and functions. We also are able to present at workshops to just share the word, get the information out there, connect people to, Access as their healthcare provider, as well as support our communities as best we can. And so with that, are there any questions that I can answer for anyone? No?
This is
Sorry.
Tessa. I do have one question. For those who are uninsured but also would be interested in applying for Medicaid, do you all help folks apply for Medicaid as well and get established with care?
Yes, absolutely. Our patient benefits team, they help people apply for Medicaid and Medicare. And that team is embedded right into our network in our health centers. And so that is a service that people can get without being an Access patient. It's a free service.
Oh.
And I don't know, did we have the benefits hotline posted on here, Maria? I can't recall. I don't think we
am posting it right now.
Thank you so much. Put that in the chat. So if anyone has any questions about, Medicaid, Medicare, they're not sure about, what they need to do. They may have questions about redetermination. They can call our patient benefits department, and a patient benefits specialist will help them with that process. And again, people do not have to be our patients to get that service. It's a service that we offer to anyone. And so, and we have quite a few of our patient benefit specialists are bilingual. So there's no language barriers. And we also have an interpreter service that can also help people that may speak another language.
I was also able to post the link to our public-facing website. It will direct you directly to our services, and particularly the information for our support services provided by the patient benefits specialist team.
Thank you, Miriam.
Thank you, Sherry
I
and
have a
Maria.
question.
Go ahead.
Sorry, Renee. Yeah. Could you share a little bit more about if you have any programs or services specifically for older adults?
I'm sorry, say that again. I didn't hear you. Was it Phyllis?
Yes. Do you have program or services specifically for older adults? And could you share more about those?
Yeah, so our overlying services all are for our older adult population. All of our health services, we have additional support services for our older adults to be able to navigate Medicare. Our patient benefits team, they just went through a recertification of the SHIP program so that they all understand the needs and how to navigate through Medicare. We also have for our health services, our older adults, they can see our providers for an hour-long visit, for an annual visit. Most times when you go to the doctor, usually between maybe like 15 minutes, maybe even 25, 30 minutes. But we want to make sure that we are providing our older adult patients, which is with as much time as they need to be able to talk to their providers, because they have a lot of questions, right? And sometimes some providers can be a little complicated, right? And not really, understanding patients understanding what they're saying. And so by giving them that additional time, it really gives the patient and the provider that time together so that everything is explained and hopefully understood so that they can make sure that they have the best care.
That's great. Thank you.
I also want to add, sorry, Sherry, that I did put in the check the direct link for the general services for adults and older adults.
Yeah, and I also want to add another benefit that slightly touched on it is we also offer transportation services to our patients. And this is especially important for older patients who may have trouble getting to their doctor's appointment. And we know some older patients, they are not fond of taking public transportation. Some are, but maybe some are not. And so when they become patients of access, we partner with a transportation vendor that will be able to pick them up from their home, bring them to their doctor's appointment, and then take them back home. And it also applies when they have an appointment with a specialist. We'll pick them up, take them to their specialty appointment, and take them back to their home. Any other questions?
There's one more question in the chat, Sherry, from Tessa saying if they live outside of our service area, can they still call the benefits specialist?
Yes, remember we have 35 health centers, so we are covering just about every area throughout Chicago and the suburbs. So we really don't have any, out of coverage area unless you're out of the state. So again, if anyone can call that benefits hotline and they can get assistance pretty much no matter where they live in Illinois. And of course, we are locally throughout Chicago, but as long as they're not out of state, they can call us and get that support.
That is fantastic news. And truly, that is just such a wonderful benefit, being able to have transportation and eliminating so many of these barriers, that stand in the way of many older adults being able to get to their doctor's appointments. So thank you both so very much for sharing all of these great resources, all the services that you provide. Again, these will go into our newsletter. You'll get these added out to everyone with a follow-up email, and we'll put all those links that they both have shared. We just really appreciate it. Such great information. Thank you very, very much. Wonderful. Well, I'm gonna open it up now and spend the rest of the time being able to talk a little bit more about other great resources that are going on. I know two individuals that wanted to share some great programs that were going on that had reached out initially. The first person is Mr. James Sullivan. For those who have attended some of our community partner meetings. I know that you know of all the wonderful services at Pay for Care that Mr. Sullivan has to offer, but he wants to share something new that has come out, followed by we're also going to hear from Tessa McEwen, who also has another resource to share. So Jim, you want to get started real quick?
Sure, just briefly. Thank you, Renee. I'm a big believer that Medicare supplement plans, Medicare prescription drug plans, Medicare Advantage plans, the best way to optimize the beneficiary's choice is not by working with a salesperson. What we've created with Pay for Care, we are a nonprofit agency, and we've created an education coaching program to help Medicare beneficiaries do it themselves. So through online webinars, through individual coaching, we teach people how during the annual enrollment period to look at what their medical care needs are going to be in next year, say 2025, and actually enroll themselves in a program that best meets their needs. Now, today's discussion, we're focusing on Part D or prescription drug plans. But I think what you're going to see in the area and over the next few years is we're going to have a lot of direct to consumer products, meaning a lot of people will be able to go in and without working with an agent, select their own Part D prescription drug plan, enroll themselves through the Medicare.gov site, and do this all without the assistance of a insurance agent. I think a lot of this has been made available. I like the Medicare.gov site. I think it's easy for people to learn and to enroll themselves with a little bit of teaching, a little bit of time. And that's what we do. So we're now offering, and I worked out there are some flyers we have available. I don't know, Renee, if you're gonna.
I was just about to put the community educational offering one. And we've got that going up into chat now. So that's coming up.
Okay, so there are two things you can do. One is we do offer cost-free webinars to groups, either groups of beneficiaries, of professionals who work in your facilities and work directly with patients and others. And you're trying to learn a little bit about what's going on with their Part D prescription drug election for 2025. As I said, there's a lot of changes that are coming and that are important to understand, but we can work with you in helping convey that message to the Medicare beneficiaries, which I like doing primarily through webinars. We can also do individual counseling through the internet. There is no fee for the webinar. There is a sliding scale fee if someone wants to work individually with us. That for people who are at low income, we do have some scholarships available. And as like the sliding scale fee can obviously goes down to very little if someone is low income, low asset. But I really believe the best way to people to get the best benefit out of their Medicare is through self-enrollment, self-education, with us standing by as their coach and their educator. And that's what we're looking forward to doing. Now, as far as timing, with this year's annual enrollment, on October 1st, the numbers for 2025 actually come out. Now, because we are educators and coaches, we do not sell any insurance products. We can actually begin working with people as soon as October 1st when we get those numbers. Insurance agents have to wait till October 15th to begin selling their product, so we can get a jump on getting people looking at their enrollment, thinking about what's best for 2025. And I've always advocated that the annual enrollment period is great to use to reassess your Medicare coverage or your Medicaid coverage and determine what changes can be best made to meet your care needs in 2025. Let me use myself as a brief example, then I'll be done. I'm undergoing a lot of health issues right now, and this year has been kind of a turning point where I'm going to look for my Medicare coverage in 2025. I know what's coming up in terms of my care needs. And so I'm going to make definite changes to my coverage based on what I know the doctors are telling me I'm going to need in 2025. Now, when you work with an insurance agent, they can't ask you those type of questions because it makes it look like they're cherry picking clients. In other words, the sicker you are, the less the insurance company wants to pick you up as a client, right?
Yeah.
With our approach, we can review where you're at in terms of your healthcare needs, what changes are upcoming, and what changes to your coverage and with Medicare are necessary to get you the better coverage you need. So that's something I'm going through now, and I think we can help your clients work through in the coming weeks. So the flyer has my phone number and extension on it. If you have more questions about what we do, please give me a call and I can explain it in more detail. But it's really something I think in years ahead, we'll see more of education and coaching and less of this selling selling through insurance agents. Not that I have anything against insurance agents. Many can be very helpful, but I think it's our approach helps to better optimize for your client, for your groups,
Yep.
the choices they make through Medicare. And that's what we're excited to be able to do. So
Perfect.
that's it. Please give me a call if you have any questions.
Thank you. And we appreciate it. Again, I posted the flyer in the chat. It's the pay for care. It's nice, bright blue and green. And again, all of Jim's information is on there, his phone number, his email address. And again, I'll post that into our follow-up email as well. Thank you again for sharing all that information. We also have Tessa McEwen who asked, she had something she wanted to share, and I'm going to post that into our chat too. Tessa, go ahead. I'm going to hand that off to you. And
Hi,
the flyer.
everyone.
Go ahead, Tessa.
Yeah, thank you. Hi, everyone. I'm so excited to see you all. And on this call are actually our in-kind community partners for this particular event. This is a reminder to spread the word about our annual dementia-friendly cruise. And this is inviting all of Chicagoland, but we really try to prioritize our local area. So it's limited to 50 pairs. To an opportunity on October 1st at noon is when you want to arrive, because we sail from 1 to 3 p.m. on an all glass topped boat, full with some snacks and a DJ. And it's valued at $200 per pair, but because we raise funds with our community partners and sponsors, we get to go for $12.50 a person. So it's really a reduced rate for each pair. And the boat is filling up, and so we want everyone to spread the word so that we can have folks come on. I'm hosting it with my colleague Amy Kiefner, and she will be the one to take the RSVPs, which are required. And then any questions, you can contact us. But we're excited to have it for the 4th time, and on the invitation you can see our news article from last year. One second opportunity that I'm finalizing details on, you might have heard of Dasha Kuiper. She is the author of Travelers to Unimaginable Lands, which is a book about caregiving for someone with cognitive impairment, dementia, memory loss. And she's been a fan favorite in the field of memory care. And she's coming to UChicago, and we're looking at September 26th on Thursday in the afternoon for a talk about why it's taking care of ourselves is so important when we're caregiving for another, especially in dementia care. And she wants to go through the brain science behind it. So we're firming up the details, but I wanted to plant the seed to save the date for Thursday, September 26th in the afternoon. It'll be likely a hybrid event, so we'll let you know more details.
Wonderful. Well, yes, please keep us posted on that. And we'll definitely be able to help circulate that information. But thank you. This cruise is a beautiful opportunity for so many. And I hope that we can get as many families out there, the caregivers, and those who are living with the disease to be able to have this wonderful opportunity. Thank you for being so diligent in getting that set up again for a fourth year, Tessa. Truly appreciate it.
Thank you. Excited to give it to all of you all. So thank you also to Share Network and the Hark Center and the Chicago Hyde Park Village. All of you all have been so helpful in helping to make this happen and spread the word.
Wonderful. We also have one more person that reached out and wanted to share some wonderful information. Again, today is like filled with great news. Margot, I see you smiling and ready to go. Margot from CDEL is here. I'm gonna let you go off and share all of the great news about Advanced Directive. So floor is yours.
I'm Margot Shields. I'm with the Center for Disability and Elder Law, and I'm the program coordinator of our program that I'll talk about very briefly. And then Lisette Ortegon is also on this call, who is our staff attorney who is running the program. We are really excited. We've received funding from the Illinois Department of Public Health to provide programming to underserved and communities, 3 communities, but we are really excited to serve communities to share advanced planning, the importance of advanced planning, powers of attorney, and other advanced planning. And so we have 2 upcoming presentations. We've done several within the community already, but we have 2 upcoming presentations we're partnering with the Blue Door Neighborhood Center in Morgan Park and in Pullman. And so we have 2 presentations upcoming that will be on advanced planning. We talk a lot about the planning itself, but also about why it's hard and why people may not have been able to do it in the past, and recognize that part. And we also are really looking to partner with many different organizations. I know some of the folks on this see some familiar faces on this call, but if you have any interest in partnering with us, CEDL has been around for 40 years. We've been doing advanced planning for clients for many years, but this is our newer program. We focus on, in addition to the advanced planning, we also focus on one of the reasons people may need advanced planning, which is the onset of memory loss. And we also provide information for caregivers as well. And then the other great thing is we're also helping people actually get the documents done. So we have, for people that qualify for our services, we have attorneys, Lisette, and then also we'll have volunteer attorneys who can help people get their documents done and ready to go. So, and I have 2 flyers I can post as well. And if Lisette has anything to add.
She's adding it in the chat. So thank you, Lisette, for adding all this
Okay.
information. Wonderful. Yes, advanced care planning has been a big topic that many people have been talking about, and I think it's a great opportunity to be able to share this. I know a lot of people have been asking for more presentations, and actually, I think everyone's wanting to stay on top of all the documentations and don't even realize what's available to them, how to get that. So having wonderful presentations like this is so important. And if you both can and don't mind sharing your contact information in the chat, because I know many people would like to maybe get in touch with you and talk about presentations for the future as well. So we appreciate you sharing all of this. Beautiful. Thank you so much. We appreciate it. Wow. Again, a day full of great resources, kind of covering the spectrum too, which is wonderful. Anyone else, any other big events that are going on? I know that there's lots going on. See, Phyllis is sending things out here. I mean, we've got lots of great opportunities out there. Anything that anybody would like to share?
Yeah, I'll just share for on behalf of Janie Urbanik. She had to run, had a little emergency, but Health Food Village is having their 5th-year Memory Cafe anniversary this Thursday from 1 to 3 at Second Presbyterian Church. And so Lorenzo's Health will be giving some entertainment with their music and medicine program. And so all are welcome to come and celebrate South Loop Village's 5th anniversary.
That's exciting. Very nice. Okay.
Yeah.
Lots of great celebration. All right. Anyone else here?
Oh, and then one more thing. We're starting a UChicago walk team for the Walk to End Alzheimer's. And so I put a flyer in the chat as well. If this is something that is near and dear to your heart, feel free to join our team on next Saturday, September 21st. I think it's from 8:30 to 1. And so you can just sign up and join us out there and just walk together for a good cause.
That walk location is stunning. And I don't know if they're going to do
Yeah,
it the
it's
way they
beautiful.
did last year, where they let you walk through Soldier Field. And we actually had so much fun because they let you walk down basically close to the field. You can take pictures inside the stadium, walk in right through. And it's another great networking opportunity to be able to get to know all the different people that are out there. And it's a beautiful event, beautiful day, beautiful views, and a great reason to attend. So highly encourage everybody to register, join that team, and get your walk on. All right. Wonderful. And if you're not able to make that walk, I know that there are plenty out there. Speaking for the Alzheimer's Association, I know, for example, my family and I are walking in one in Tinley Park. So they've got one around the Tinley Park Metro. So suburbs, they're all out there. They've got Naperville, I think, and lots of great ones. So yeah, that'd be a great opportunity for everyone. But UChicago is going to be focusing there at the city one. So that'll be perfect. All right. Anyone else? Again, thank you all that have attended. We truly appreciate you spending your Monday with us. Thank you for the resources and, being able to share everything and keeping everyone in the loop. We do appreciate you and the time you spend. I will be sending out just a follow-up with some more links. If you need anything, please feel free to reach out. If you're interested in presenting for one of our meetings and have a topic you think that, or you have a topic that you would like to see brought forward, feel free to reach out to me. I would love to kind of get you slated on the next few months. I'm looking for a presenter for October, so feel free to reach out, but take good care. And thank you again for all the work that you do and for being a wonderful partner with the Share Network and for being part of this network period. We appreciate you, and as do all of the constituents out there. So thank you so much. Take good care, and we'll see you next month.